On behalf of my groupmates, allow me to extend a warm welcome to all of you from the City of Friendship, Tagbilaran City. My name is Gurli Panyakotamora from the College of Physical Therapy and Occupational Therapy at the University of Bohol. The prestigious University of Bohol, standing on the pillars of scholarship, character, and service, is located in the heart of Bohol's capital, Maria Clara Street, Tagbilaran City, Bohol. Our research study is awareness, attitude, and belief in physical therapy services among city healthcare workers in Tagbilaran City, Philippines. I am an undergraduate currently taking up Bachelor of Science in Physical Therapy in University of Bohol. Let me begin by discussing the background of our study. Physical therapy has become more apparent and is now a widely recognized healthcare service. It is a medical treatment used to restore functional movements such as standing, walking, and moving different body parts. They are often an important part of preventive care, rehabilitation, and treatment for patients with chronic conditions, illnesses, and injuries. According to the law in the Philippines, direct access is not permitted, and people are not allowed to refer themselves to physical therapy in private and public practices. That's why doctor's referral is needed. As it said, increasing awareness about physical therapy can positively influence the beliefs and attitudes of many, resulting in the effective delivery of healthcare. In line with the framework, healthcare workers, including nurses and midwives, are often the first point of contact for patients in their communities, where they can recommend physical therapy services to their patients in need. Nurses and midwives greatly impact the effective delivery of healthcare to the community, especially for patients who require physical therapy. So this study aimed to examine the healthcare workers' perceptions of physical therapy in terms of awareness, attitude, and beliefs. These three attributes help us to assess and understand whether they have adequate knowledge of physical therapy, how physical therapy can help their patients, whether it is effective for their conditions, and whether they do recommend it for their patients. We, the researchers, also aim to understand whether working as a healthcare worker for a long time affects one's awareness, beliefs, and attitudes toward physical therapy, or whether it depends more on the profession of the healthcare worker, including the nurses and midwives. So, for the methodology of this study, this research study utilized a descriptive quantitative type of research that aimed to analyze the respondents' awareness, attitudes, and beliefs on physical therapy through the use of a modified questionnaire obtained from the study entitled Awareness, Belief, Attitude, and Utilization of Physiotherapy Services in a Nigerian Population. To avoid unethical content modification, we successfully secured a letter of approval from the author of the said study. This study had 42 eligible respondents who were contacted through their emails, Facebook accounts, and phone numbers. Presented on the screen was the selection criteria of the respondents. So for the results and discussion of our study, so first table, we have the relationship between the level of awareness of healthcare workers about physical therapy as to their profile. So the results are as follows. With the first variable profession, there is an insignificant degree between the said variable and their level of awareness. This means that the profession is not influenced by their awareness of physical therapy. With the second variable, number of working years, there is a significant degree between the second variable and their level of awareness of healthcare workers about physical therapy. This means that the longer the number of years of service, the higher the level of awareness about physical therapies. A possible explanation for the correlation is that the higher number of working years allows more opportunities to interact with physical therapies and be exposed to the practice. There is evidence to support this. It has been shown that the exposure to physical therapy enhances positive perceptions of the practice, especially when physical therapy yields positive outcomes. Second, in profession, the results state that there is no significant degree of relationship between the profession and the level of attitude towards of the healthcare workers toward physical therapy. In number of working years, the results state that there's also no significant degree of relationship between the number of working years and the level of attitude of the healthcare workers towards physical therapy. This means that the attitude of the healthcare workers does not influence by their profile. Third, in profession, the results states that there's no significant degree of relationship between the profession and the level of belief of healthcare workers about physical therapy, as well as in the number of working years and between their level of belief in healthcare workers about physical therapy. This means that the belief of the healthcare workers about physical therapy are also not influenced by their profile. And next, and then the results for the analysis of correlation between the awareness and attitude are as follows. The level of significance is 0.290, thus the null hypothesis is accepted. This means that the level of awareness of healthcare workers on physical services does not influence their level of attitude toward physical therapy. While between the attitude and belief, the level of significance is 0.010, therefore the null hypothesis is rejected. This means that the level of attitude of healthcare workers toward physical therapy can influence their level of belief towards it. While between the belief and awareness are as follows. The level of significance is 0.057, thus the null hypothesis is accepted. The level of belief in physical therapy does not influence the level of awareness of physical therapy. And then, and then on the screen are the results of the analysis of the differences between nurses and midwives as to their level of awareness, attitude, and beliefs. All in all, between the two professions mentioned and the three attributes, which are the awareness, attitude, and belief, the null hypothesis is accepted. Thus, this means that nurses and midwives have no significant degree of differences in their level of awareness, attitude, and beliefs towards physical therapy. So for the conclusion, limitations, and further research, allow me to read. The study aims to benefit multiple stakeholders within community by determining the levels of awareness, belief, and attitudes of city health workers. Gaps in knowledge, understanding of the rules and benefits of physical therapy can be identified and solutions can be formulated to address them. The findings show that number of working years positively correlates with physical therapy awareness. The question of whether the respondents think they need to know more about physical therapy was ranked the lowest among the four items in a questionnaires awareness subtest, which could be a potential area for future research aimed at identifying the extent of respondents' awareness of physical therapy and addressing gaps in knowledge. Respondents demonstrate relative uncertainty regarding the ability of physical therapists to diagnose and treat individuals who seek physical therapy. This is a potential target area for awareness campaigns and focus on the aforementioned topics. The researchers recommend the following to future researchers to conduct a study on a larger scope that includes other healthcare professionals such as barangay healthcare workers, nutritionists, dietitians, and non-professionals, and expand its environment to other places within or outside the scope of Bohol province. The researchers also recommend including culturally diverse locations because it is clear that different cultures have different beliefs and traditions when it comes to medical treatment. The researchers also suggest conducting a study other than the correlation of awareness, attitude, and beliefs with a larger scope and using other data collection methods. The researchers suggest creating, planning, organizing, and implementing programs that are designed to raise awareness of physical therapy through mass media or by including it in clinical seminars. Physical therapy must be constantly shared at every clinical seminar so other healthcare workers will be aware of what they do best since it is a multidisciplinary approach in the health community. The researchers also suggest that schools will implement more community based rehabilitation programs for physical therapy students. And for the impacts and outcomes of the study, the result of this study with regard to the perceived level of attitude of the respondents about physical therapy services show a positive outcome. Thus, the researchers recommend a rehabilitation training program for city healthcare workers in Tagbilaran City to improve their attitude toward physical therapy services. The researchers suggest physical therapists provide health-related seminars in health centers. So this is a bibliography, and that's all. Thank you.